being the end of an hour at 10 o'clock, otherwise it's going to be a very short session. Thanks all for coming. Thank you to Ibrahim. Thank you, my friends. Thank you to SME4Labour, and thank you to all the staff here who have supplied a lovely breakfast and tea and coffee, etc. Of course, I want to thank you, Ashley, for coming along this morning. My friend, my colleague, the Minister for Public Health.
I know.
Amazing. Thank you for agreeing to be my guest speaker and answer some questions from everybody today. And Ashley, although new in her ministerial role, was absolutely thrown into the deep end and led the tobacco and vapes bill debate last week in the chamber. So well done for you on that. Ashley's a great MP, always fighting for equality, for speaking up for communities, and I'm so pleased that you have the public health brief, Ashley. The last government left behind so many failing systems that impact on public health, from the NHS to local authorities to education, systems that are failing the needs of children. And in my constituency, we have one of the highest rates of child poverty. We're classed as a dental desert with no NHS dentists left. We've got 1 in 5 5-year-olds with tooth decay. And these issues I know, Ashley, you care deeply about and will feed into the government's 10-year health plan. Thank you to everyone here for coming. Businesses are at the heart of our government's plans, and last week I held a meeting in Parliament for businesses from the North East, discussing how we can unlock the North East economy and its great growth potential. And I had a breakfast meeting also last week with the Minister for Small Businesses, Gareth Thomas. Excuse me a minute. So, our government has announced ambitious long-term plans for growth, and it was great to see £70 million North East investment announced last week, for example, and an announcement for an NHS crack team in Newcastle Hospital. I always hesitate when I say that. I'm not sure about crack team, but there you go. That's what Wes is calling it, so there you go. And that will be a part of the drive to get the NHS waiting lists down, and we've already seen that happening. Small businesses can help us with our plans for growth, our public health improvements, and so much more. And I know to do this, we need the right investment, infrastructure, and to empower our small businesses. I'm really pleased to have here today Jeff Thompson from South Shields Football Club from my constituency. Jeff's also the chair of Jarrow Forward, the town fund, which has been awarded £20 million to revitalise Jarrow and the town centre. So thanks for everything you're doing, working with me and others, Jeff, on that. I've also been working with ministers to deliver an ambitious plan for Hebburn FC, and they're not rivals, they're very much friends. Another one of my local football teams, and government funding will help transform the club into a community hub. I mean, it's already a community hub, but an even bigger and better community hub. And that, of course, feeds into public health of our community. So, you know, there's, I think, a great example of how local partnerships with MPs can champion local businesses and work with them to deliver what I know will be huge benefits for our communities. So I'm pleased to have those of you in the room with companies, with retailers in my constituency and other national bodies like the Food and Drink Federation. Thank you all for coming. I know many of you will have questions for Ashley, and so Ashley, I'd ask you to say a few words if that's okay, and then I'll open it up. I'm not going to ask everybody to do introductions because we're already running a little bit late, But after Ashley said a few words, I'll open it up. Please introduce yourself and say where you're from or who you're representing today. Okay, thank you, Ashley.
Thanks, Kate, and thank you all for your patience while I hot-footed it from the Department for Health and Social Care on the other side of the river. So I got the times a little bit wrong. And thanks everyone for being here. And I think, you know, it's a real testament to Kate as an MP and her sort of convening power to be able to bring together such a wide range of people to really focus on you know, particular issues and what we as a Labour government are doing and how businesses can feed into that. As Kate said, I'm the relatively new Minister for Public Health and Prevention. But I think, you know, what really strikes me, and I think it's particular as well about the way this Labour government is governing, we have committed to deliver something, you know, a mission-led government. And that means that as far as possible, what we don't want to be doing is working in silos. So, you know, Kate hasn't put in front of you just the Minister for Small Businesses, although he was here last week. But it's also about saying, what are businesses doing for everybody? How does it work right across what government is trying to achieve? And that's really important for me, for public health and prevention, because actually so much of my remit is actually, you know, covered by all different communities across the country, in terms of businesses, in terms of schools, in terms of you know, all local authorities. It really is a joint effort. And so when I was preparing to come here today, I was trying to think, you know, what is it that small businesses can do and what can we do in terms of the public health and prevention agenda? And I think there's so much opportunity in there. I mean, what we're doing in terms of public health is really around trying to influence behaviours and try to create environments where people can make those healthy choices. Not least because we want to relieve pressure from the NHS, which is severely under pressure, but also it's part of our 10-year plan. We're developing at the moment a 10-year plan to turn the NHS around, and there's 3 big shifts in order to do that. The first one being from analog to digital. So we want to, you know, get the NHS into the 21st century so that we're using technology in a way that allows us to do things better, to do things more efficiently. Things like using AI on breast cancer screening, which will make it much easier to identify early breast cancers. And we're also looking at from hospital to community. So the idea that actually not everything has to be in the acute sector. You don't have to go to the hospital to access those services, where it might be better to be able to get those a bit closer to home, and where possible, particularly with using technology, in your own home. And so the development of those technologies are absolutely key, and the development of community services so that we can effect that shift is crucial. And the big one that affects me is from sickness to prevention. Not everything, obviously, is preventable, but where it is, we want to do that wherever possible, so that rather than the NHS being basically a national sick service, that, you know, deals with you when you're sick, part of it is also about keeping you healthy to begin with, because we know that it's much easier to prevent things than it is to cure things. Some things, particularly things like diabetes, cardiovascular disease, if we can change some things that make it easier for people to live healthier and to identify those conditions sooner, then we can prevent those conditions becoming long-term and debilitating. And why do we want to do that? Well, obviously we want to do that because that's quite good for people. It's quite good that we keep people healthy. But it's bigger than that, because it's absolutely crucial for our economy. And you'll have heard us talking last week and the week before about support to get people back into work, and the vast numbers of particularly young people that are not in education, employment or training. just written off seemingly to a lifetime of benefits due to ill health. And so part of my job isn't just about providing health services, it's about making sure that young people, or all people, have the health that they need and the support that they need to be able to contribute to a wider community, and that includes to your businesses and to our economy. So I suppose that's where it comes in terms of small businesses and larger businesses. It's about how can we work with you, what do you need to be able to put in place the support that some people need to be able to get back to work, for instance. I've done a fair amount of talking about work and health. You probably won't know this, but so back in August I was diagnosed with an incurable metastatic breast cancer. Don't get shocked, I'm fine. But what that meant, as soon as I got that diagnosis, it took seconds before a health professional wanted to talk to me about giving up work and what benefits I could claim. This was before we had any staging, before we knew the extent of the disease in its entirety, before we had a treatment plan. As it turns out, I'm what's called no evidence of disease, and I have 3 monthly monitoring, and I'm absolutely fine for now, touch wood. But what really struck me was that straight away the system kicked in to say stop work, take up benefits, go home, take up crafting. You know, and I was just like, this is such a shock. And I'm not the only person that will have received that kind of information. And I thought, well, what we really need to focus on is saying to people, okay, how do we change our workplaces? How do we support you to stay in work? Not how do we get you home as soon as possible so that you can, you know, sit down and worry about what's going to happen next. So I see that very much as part of my role in public health and prevention. And that's where we want to work with local businesses, small businesses, to say, what do you need to be able to keep people at work? What do you need, what support do you need to be able to put in place reasonable adjustments so that people can carry on contributing to your businesses and contributing to the economy? And what is that going to take? And I'm working really closely with the DWP. I hosted a round table with businesses on health with Ali McGovern, the Minister from DWP, a couple of weeks ago, to start having these conversations and to feed into the government's Get Britain Working paper. Because, you know, we all need to work together in order to make that happen. So I'm absolutely delighted that you're here. We've all got a role to play, whether that's football in terms of promoting mental health, you know, in community. I mean, I am no football fan. I barely understand it, although I did used to be able to describe the offside rule. But what I am passionate about is what football means in terms of community and belonging and mental health, because it's about, you know, it's about us all being part of something together, and that is crucial. So whether it's about that, whether it's about promoting physical activity through, I'm sure, some of the sort of community and sports activities that you do, particularly perhaps with young people, or whether it's about making sure that we've got, you know, cities and towns that are built so that people can be healthy in them, whether it's about companies that provide services such as cafes, restaurants, etc., where people can be, where we promote community. It all contributes towards the health of the nation. It all contributes to the economy, and that's why I'm really delighted that I'm here today, and we can perhaps have a conversation a bit more for the rest of our time about how we can work together, and I'm really looking to hear your ideas, because my sort of big mantra ever since I was elected has been that the answers to our community's problems are very rarely alone only in the corridors of academia or the corridors of power. Our communities know what's wrong, and our communities have got the ideas for what the solutions might be. So I'm absolutely delighted to be able to be here to discuss some of those things with you today.